U.S. Senator Tim Kaine made a stop in Southwest Virginia this morning, touring a rural hospital in Lee County.
News Channel 11's Brody Wilson shares what the senator had to say about recent funding cuts out of the nation's capital. Brody?
Yeah, Sarah, Casey, Senator Kaine actually helped reopen the hospital back in 2021. And since the passing of President Trump's Big Beautiful Bill in July, he's been working on legislation to combat the cuts to food assistance programs and Medicaid in order to keep funding for rural health care.
It's a real amazing story, a hospital, especially a rural hospital that closed and then reopened. So I wanted to come back and see, okay, how is it going? How does Lee County feel about this? How's the hospital and the ballot network serving the community?
Kaine says there were elements of Trump's Big Beautiful Bill he agreed with and even had some of his own legislation included, but voted against because cuts to Medicaid and other programs were too severe.
I'm worried about how those cuts to Medicaid or how the cuts to premium support that people get to afford health insurance could affect rural hospitals.
He believes there's an openness to discuss possible middle ground solutions with his colleagues on both sides of the aisle, with budget season right around the corner.
And I think there's going to be an opportunity in that discussion in September. Might we go backwards a little bit on some of the cuts that were made? Might we soften the blow? Might we figure out ways that both individuals who are receiving care, the patients, but also the providers, are not affected so significantly?
And that he's focusing on Southwest Virginia as a part of the state that relies heavily on Medicare.
Because of the age of the population in Southwest Virginia, it's higher than in some parts of the state. So any cuts to the Medicaid program do have a disproportionate effect here. I know what the statewide projection is, that the bill that was passed, the GOP bill, if it's not changed, about 325,000 people in Virginia will lose health insurance.
We also spoke with Cindy Elkins, the administrator at the Lee County Hospital. She says the hospital is financially stable because of the support from their representatives and hopes they can be an example for other rural hospitals.
We truly believe that rural health care could look to Lee County as an example of how to do it. And we're giving that information to our leaders and sharing it, and willing to go to conventions and talk about it, willing to go to Washington and talk about it.
The legislation Kaine introduced is called the Improving Care in Rural America Reauthorization Act, which will try to regain some of the federal grant programs that have been cut. Sarah, Casey?